Hello, I'm Tevi Troy. I'm a senior visiting fellow at the Hudson Institute here in Washington, D.C., and I was until recently the Deputy Secretary of the Department of Health and Human Services. While I was there, I did a lot of work on pandemic flu preparation, which is helpful in many ways, not just in terms of flu, but in terms of biothreats that we could face in general. This preparation, I believe, has served our country well and in good stead in this recent swine flu or H1N1 pandemic possibility here that we are facing with the outbreak in Mexico and some cases in the United States as well. What we've learned in the past is that the nation needs to be prepared and have a multi-tiered, multi-layered approach to dealing with pandemic issues and biothreats of all type, because the federal government, the states, and the localities all need to play a part, but we also need a lot of cooperation with the private sector. For example, there are a lot of companies that prepare needed countermeasures that help us deal with pandemic and deal with other types of biothreats. Companies that prepare vaccines, let's say, or antiviral medications like Tamiflu or Relenza that have been essential in dealing with this current threat. Also, we have masks and respirators and all kinds of other countermeasures that are in our strategic national stockpile that are ready to be distributed at a moment's notice in case of a problem like this. What I have seen in the case of this current pandemic is that the United States government has actually acquitted itself quite well, and I'm quite proud of all the efforts that went into our preparation and our response in this particular circumstance. The scientists and the technical people at the CDC were ready to jump on this issue, to distribute the countermeasures as needed, to send out the appropriate messages. I would like to see more officials at the senior ranks at HHS, the Department of Health and Human Services, confirmed and ready to go, because right now we're dealing with a public health crisis and we don't have a full public health team in place, and I hope we will see some improvements on that front shortly. Also, it's very important that we have the right messages when dealing with a pandemic or any type of biothreat. It is very easy for people to panic, and I'm very concerned about the problem of panic. If government officials say the right things, reassuring things, accurate things above all, but they need to tell the people what to do and how to do it, and if any action needs to be taken. Sometimes you see unfortunate statements like one made by a European minister who said people shouldn't be traveling to North America at all in this circumstance. I don't think that is accurate. I don't think that's true, and I think that is problematic. Fortunately, she walked back the statement and no longer said that after she was told that it was not accurate and not the right thing to say. So I think our government officials need to be measured, need to be thoughtful, but most of all, they need to be prepared. And I'm very proud of our government efforts thus far in dealing with this problem. Thank you.